Thank you, Chairs Kelly, Barragan, and Wasserman Schultz from the Steering and Policy Committee and our leadership for hosting this important hearing. This week, during his recent cabinet meeting, the President of the United States attacked Democrats for talking about the high cost of living. He said, and I quote, "The word affordability is a con job by the Democrats. The word affordability is a Democratic scam." A con job, a Democratic scam? Isn't this the same guy whose campaign centered on lowering the price of eggs? The same guy who declared himself the affordability president? I cannot believe anyone has to say this, but affordability is not a con job or a Democratic scam to my constituents or to constituents anywhere around this country. And anyone who says otherwise is plain wrong and frankly lying. You know what isn't a Democratic scam, but is a direct result of Republican inaction? The looming expiration of the advanced premium tax credits. These affordability lifelines helped double enrollment in the ACA marketplaces and drove record low uninsured rates. But they are all set to expire in just a matter of days. Why? Because Republican leadership has refused to work with congressional Democrats, but we only need 4 here in the House to break from their chaos and to stand with the American people. And now marketplace enrollees are already feeling the impact. Nevadans using Nevada Health Link, my state's ACA marketplace, now face premium hikes of over 26%, well above the originally projected 17.5%. What is driving this increase? The expiration of the advanced federal premium tax credits that we have been working to champion for months. And even if we can convince some of our Republican conference to extend these tax credits, the Congressional Budget Office projects that 1.5 million more people could be uninsured in 2026 compared to an earlier extension. So if you ask me, Republican inaction is the real con job. That's the scam. Mr. Mungi and Ms. Schief, just this morning, the Kaiser Family Foundation released a poll that found that due to the rising cost of marketplace health insurance, nearly 67% of households say they would likely have to cut other household expenses. I have a group of students who are here from Jobs for American Graduates from Nevada, and I know that they're going to be talking to me about these and other issues, but what does this effect have on you and households like yours?
We live on a fixed income, and we live within our means, so we have a strict budget. And so if there's going to be more expense for health care, then that needs to come from something else. So we have to make the decision on, do we apply for more services, like applying for electric assistance, or do we cut down something else? Like my children, I try to get them into extracurricular activities. Those things will probably need to go away to be able to cover just our health care. So it has to come from somewhere, and with the expenses of groceries going up and everything going up, we have to cut, or my husband has to work more. And right now he is working from like 5 to 10 at night because he's our only source of income.